Welcome everybody to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. My name is Madeline Golick. I'm the owner of Ecophysiotherapy as well as a pelvic floor physiotherapist. And I am very happy to have Adrijana on the show today. So welcome.
Hi, thank you for having me over today.
Yeah, I'm really interested about the topic we're going to speak about. But before we get into that, I thought maybe you could tell us a little bit about you.
Yeah, so I am born in a very small country in Europe, Macedonia, and my background is I'm a medical doctor. I immigrated in Canada in 2002, and what I do now, I help medical doctors, immigrants, and the one who are trying to come to Canada to help them pass the Canadian exams.
Excellent, yeah. So what made you decide Canada?
There was a war in a neighborhood country in 2002 in Kosovo, which was not very safe at that time. So with my husband, we decided to come and bring our first son. He was 2.5, and give him a better future. Canada was open towards immigration at that time. So we came since then.
Yeah. And so you mentioned that you were a medical doctor trained back home.
Yes.
What would you say was your greatest challenges immigrating to Canada and trying to integrate into the medical system here?
Unfortunately, I'm probably not the only one that had to go through this pathway. One thing is passing the exams, but the second problem is getting into the residency program, which can be very challenging, and having also all the logistics of leaving and have a financial support as well while doing all these exams. So going through that struggle and going through that pathway, we had decided to create a teaching institution to help other doctors to pass these exams in a different way with less trouble.
Mm-hmm. So as a foreign trained physician, you have to. Is it just written exams that they need to pass, or is it practical exams as well?
Some are written, some are practical exams. The problem is when people immigrate here, it takes a certain amount of time to take these exams, and while they're taking the exams, they're out of practice for some time, which is not good later on for their application. So we, in a way, guide our doctors to take the exams while they're still sitting back home, while they're still practicing, being in touch with the medicine and practicing with their in their field, and then coming to Canada as a ready, having all the exams and apply. If they are lucky to get into the program, then they can come with their family and start their life as physicians. If, on the other hand, they're not very successful to get a spot, then we, in a way, guide them to get some certificate and get some alternative profession that is still in medical. If they're ready to immigrate and become ultrasound technician or maybe X-ray technician, a researcher, something that's still in the field of medicine.
Right. And then you mentioned that there's like a residency portion. Can you talk about what that is?
Yeah, so besides the exams that are something that we need to do as a big prerequisite applying for the residency program, there's very limited spots, especially for us international medical graduates. They call us IMGs. And it's a very competitive system. Not a lot of spots are open. Therefore, a lot of doctors are not able to get into the residency training.
Okay. And so if they're unable to obtain the residency, then they're not able to
absolutely
practice.
They cannot practice. Yes.
Okay. How long is the residency?
Depends of the specialty. Let's say family medicine is 2 years. If someone wants to do internal medicine, then it can be 4 years. Then subspecialties can be more. If
Right.
one wants to become a cardiologist, then they'll have to go for 8 years minimum. So depends of the specialist program, depends of how many years of training they have to go through.
Yeah. So your program does, so you're helping them pass the exams. Are you also able, like, to find residencies in other provinces, or are you just more Ontario?
No, the exams are for all the provinces.
Yeah. But the residency part.
The residency, unfortunately, there's a lot of factors that are dependent for the residency program, and some provinces have different prerequisites. We cannot help one with the residency program. However, we try to still guide them how to write a proper portfolio, CV, and personal statements, just so they will be what extra certificates are good to have for certain programs and so on. Or if someone is already in that program, then we make a connection just so they can communicate, they can get some extra information. However, we cannot help a lot with the residency program.
Gotcha. Okay. What about individuals who have been in Canada for several years now? Is there a limit that you can write the exams and get the residency? Like, is there a time frame that you have to be within?
So this is one of the problems that I myself are facing, because I was not able to take these exams while I was new into Canada, and I'm out of practice. If you're more than 3 years out of practice, then it's not very good for your portfolio and for your application. So I'm looking into going into another country and get my residency to be able to apply again.
Right. Okay.
So, and this is the most important portion of the newly immigrants that are coming. They unfortunately they do not know that the further you are away from practice, the tougher it's going to be inserted later on for the residency application. I have seen cases where even though people are out of practice for some time, they were accepted. However, it's better if you're newly graduate or if you're still practicing.
Right. Okay. Are you guys helping people sort of navigate and educating about what they sort of, I assume that that's what your services offer, is like helping new immigrants or individuals who may be thinking about immigrating to know exactly what steps they need to take in order to get to practice.
So not only the immigrants and people that are trying to immigrate, we also help students that are studying abroad. Let's say students are finishing in Caribbeans or in some English programs in Europe, or students that are trying to they know that they want to get out of their country. So we prepare them to pass the exam. So once they graduate, they have the exams ready. The education is simple but very tough. There should be a lot of background knowledge as well as English proficiency, especially for the second exam, which is oral, which is the OSCE exam. The proficiency in English should be quite well for them to have a higher score. So these exams are not only to be passed, but we train our doctors to pass them with a higher score, so they will be competitive later on for their application. Exactly.
Right, gotcha.
Simply because passing the exam does not give you a lot of chances to get inserted.
Right. You're giving me flashbacks to my OSCE exams, and I just remember thinking, like, I'm gonna die. I'm like legitimately going to have a heart attack. Your palms are it's so stressful. I can imagine for somebody coming to this country, not really knowing the area, not really understanding the processes, just even like, where do I drive to?
Exactly.
Like, how do I get there? Like,
Exactly.
I can imagine that even adds a higher level of stress. And I mean, I was lucky, we had a group of us students who came together and like we were practicing
Yes.
and practicing scenarios, but that might not be something that's available to a single practitioner back
Exactly.
home, even though you're practicing. But the thing is in physio we learn about stroke and neuro rehab, we learn about cardiorespiratory physiotherapy, we learn about orthopedic physiotherapy.
Gyna, you're
Well, yeah. Well, for exam purposes, that's post-secondary, or not post-secondary, but that's after your master's program. That's additional training. That if you're not practicing in these other realms, so me being an orthopedic physiotherapist, if you were to ask me now about cardiorespiratory physiotherapy, I mean, I have some vague ideas about it, but you just don't retain information you're not using.
Exactly.
Right? So if you're, maybe in family practice, you might not be necessary, like you might have a good broad general scope, but maybe you need more specifics and like.
So that's why our trainings are a little bit different comparing to other people training at different institutions that are offering. Simply because we have individualized training. Let's say if someone who is a neurosurgeon from Dubai or Kuwait is trying to pass the Canadian exams, their knowledge in different areas, let's face it, have faded over time, right?
Right, yeah.
And we try to assess the levels of knowledge where this person is lagging behind, and we pinpoint to that point.
That makes total sense.
Exactly.
Yeah, because a neurosurgeon likely doesn't need to spend as much time.
Exactly. However, I don't teach him neurology because that's the area of expertise. So this is one-on-one education. It's individualized. A lot of the education is done online, and it's usually at the time convenient for these people, for their time zone. Sometimes it might be 2:00 in the morning for me. However, I am there online. And part of this preparation is also involved in-person training. So a lot of people, once their online education is done, then they can come in Canada for a week or 10 days, and then we work with them for the practical portion especially. Also, we have mock exams, which are simulated exams. So that all anxiety of OSCE should come down.
I wish I could say the mock. I mean, because in physio school, we had, like, part of our exam was written and OSCEs, and we had 6 units. So we went through 6 OSCEs.
We have 12.
Yeah, so when it came time for OSCEs, though, it's still, because it's like, it's sort of like, this is the line. You have to pass these. Well, I mean, there's opportunity to redo it, but, as a student, you're excited to get started. It's just, it's a tremendous amount of stress. So the more practice that you can get, certainly, once you are in it, it's good. It's that first room, then, you know what I mean? It's just like, hands are,
So we train our doctors from every single perspective and aspect of the exam. I'm so particular. I even see what my students are going to wear on the exam, how they're going to look, because it's a exam where they see you as a whole package, and how you look, how do you drape your patients, how you interact, and what's your communication skill. And fortunately, you guys were lucky, you could retake the exams. Some of our exams you cannot. Once you pass it, this is it. This is your score. You cannot retake it. So it's very important to be comfortable and confident and go on the exam and just get a good score.
Right, okay. Yeah, well, I guess it's a little bit different because your scoring on the test really impacts your ability for that residency.
Exactly.
For us, it's like once you pass, you're passed. Exactly. Like, it doesn't necessarily, employers aren't asking for your, practical exam results. But I guess for medical professionals, they might ask.
But, Madeline, at the end, I tell my students, I want to make sure I see you how you do that McMurray test, because if it's my daughter or my son,
Oh,
and
absolutely.
you're an ER doctor, I want to make sure you know how to properly provide that test. So
Yeah,
one thing is
absolutely.
the exams, but the second thing is the reality, and we're all dealing with human beings, right? You have it's someone's loved one there.
Yeah,
you have to treat them properly. You have to deal with your patients. The knowledge should be there, not only for the portion of the exam, but also for the sake of our patients as well. So
Oh, absolutely. Yeah. No, I agree. I just know that going through the exam is such a very high pressure
Yes, it is.
situation, and
It is.
and so the more you can practice, the more likelihood that your muscle, like we would say, muscle memory. You know what I mean? The more that sort of
Exposure,
kicks
the
in.
better.
But
Exactly.
there are certain people who don't perform well under pressure, even though they're very smart. They know their stuff.
True.
So if you can
True.
practice and get your anxieties, in check to some extent, that
But
can be helpful.
it's all training.
Yeah.
If you are trained to go and run 20K, right, then you'll do it. If you put me now to run 20K, that's not going to happen.
Yeah. Yeah,
So
that makes sense.
I train my students to run 50K, so then later on they can go and run 20K without no problems. So that's just one simple example. The training, it's very important to train it, and train it within the time when they have to go. And if the time is 8 minutes, I give my students 6 minutes, just so 2 minutes something goes wrong, they can still,
Right.
work and pass that station successful. So it's all training.
Yeah.
It's all training at the end.
Absolutely. Yeah. Experience training, very, very important. So doctors, I mean, it's got to be sort of pricey, like that when they get here and in that transition zone. Like how do foreign doctors keep themselves financially afloat?
Well,
I imagine that's a huge barrier.
yeah, and unfortunately, we see a lot of doctors that are driving taxis, and they are working in jobs that are really not supposed to be. On another side, we're waiting to see a specialist for 6 months or so.
Right.
I mean, I can't change that.
Yeah.
However, what we can do, we can try to get these people with a smoother transition. Someone who is really financially struggling can also benefit from registering with us. I do volunteer every Thursday in the Immigration Center in Oakville for free. And this is my give back to community. So people that cannot afford to pay for any of the courses, then we help them that way. I
Okay.
believe in giving back to the community. I believe in helping each other, and I try to engage them later on, people that have passed the exams, to help other people. I believe in help.
Right. So sorry, you in Oakville?
Yeah, in the Halton Multicultural Center.
Okay.
I do volunteer every Thursday from 4 till 8.
4 till 8. Okay.
Any doctors that are, in need, they cannot afford, they can come over there and they can help. They can get help. On the other side, if someone is not in Oakville or not in GTA, is somewhere in Edmonton, or we still do try to help them. We run few sessions. On a monthly level, or depends of the exam structures. Then we run group sessions where they can ask me questions and they can interact, or maybe we can connect them with study partners where they can help each other and so on. So it's a group discussions. It's just trying to get them engaged together, just so they can help each other.
Yeah,
Exactly.
that's a great a great thing. So what about, just a little further detail. So if there's a physician practicing currently somewhere out there, and they want to start studying for the exam. So you're saying everything is online. How does that?
Not everything.
Okay.
Part of the education is online. However, for the practical exam, there's a portion where they will come and they'll have that simulated exam for
Right,
a
okay.
mock and so on. And, because it's individualized learning, then we constantly do an assessment if there's any need for someone to come and spend a few days here or a week or two, then obviously it's a different approach than having a group session of 50 people. You cannot assess your students. You can just deliver the theory, deliver the knowledge, but then you do not have that assessment, which we constantly do especially when I teach. I ask to make sure I see how much they do not know, and then I teach the topics that they do not know.
Right. So they can prepare for these exams back home, but they have to write those exams here.
In Canada, not necessarily.
Okay.
The first exam can be written in few centers around the globe.
Okay, so they can already be sort of completing some of the exams
Exactly.
before they immigrate, but the practical exam is done here.
The practical exam is
okay.
here. Yes, the OSCE exam is here, and the qualifying part 1, which is the third exam, is also done here, and the fourth exam is done
So
here.
do they have to have their status of being a citizen?
No, they can come as a tourist, they can take the exam and go back home. And in fact, if they're trying to immigrate in Canada, having these exams will boost their application for immigration.
Right, so
process.
they don't have to, so they can take the written, the practical, they can do all the exams, but they can't do the residency here until they're a citizen.
Yes, and we don't advise, simply because if they get matched and they don't have their PR card, then
that would be awful.
Yeah, exactly.
Right, okay, that makes total sense. Is there anything else that you would want somebody to know? Maybe they're already here, or maybe they're thinking about schooling there and then coming back, or they're physicians in another country. Is there anything that you would want them to know while you have this opportunity?
Yeah, so unfortunately, I see a lot of people that are going to medical school abroad.
Yes.
And, these are young individuals. Like, I have an 18-year-old son. He's thinking of going to medical school. So as a parent, I was ready to sponsor him $80,000 to $100,000 in Australia or somewhere else where he could go in. But these young students do not think about the future. Where do I go after 5 years or after a certain amount of education? What is my future?
Right.
Some doctors are smart. Some are just thinking, okay, the only thing I need to do is to graduate. No. They come later on and we see them struggling again, graduating, do not have internship, do not have exams, they want to apply, they realize that it will take them a year or two additionally.
Right.
And it's a whole struggle. It's a whole struggle.
Because they didn't plan for the extra things.
They were not familiar with the system. So my suggestion would be, if you have a child that is studying somewhere, or if you have, or if yourself are studying somewhere, then plan things in advance. A smart student apply for the UK exams, for the US exams, and for the Canadian exams somewhere third or fourth year while they're studying medicine. One, the knowledge is very fresh. Step 1, which is the first American exam, is all the basic science. There you go. You can just take it while you're studying all the basic medicine.
Yeah.
Some of the clinical exams, like the OSCE we said, it's the American CS, PLOB 2, and NAC, OSCE, QE2. There are all 4 exams that are very similar in the structure.
Right.
So with one smart education, a smart move, they can
just get it
clear
done.
your exams. Exactly.
And then that reduces a lot of stress later.
And then you have opportunities to apply in few countries, right, at the same year, and have not only one application open, but have few.
So you have choice then if you don't get one place, you're not scrambling last minute. Okay, that's smart. I think
Absolutely. So this is where I would like to help these people to navigate them.
Right.
Few people from Romania recently contacted me. Apply to the residency program here. Did not get selected once, twice. What do I do?
Right, exactly.
Right.
Yeah, that's a really, really great tip. And I think on that note, I should probably mention to anybody listening that might be interested, we'll have your contact details available at the end of the video. So if you want to find out more about Adriana's program or how she can help, if you have kids who are thinking about med school abroad, or any questions, you'll have her contact details. I want to thank you so much for coming and shedding some light on this, because that's a reality that you might not practice here. So have a plan, know what you need to do, and get help to make sure that you are able to practice your craft and your passion and your love, right?
Yeah, medicine is different than other professions. You have to have that gift of giving and gift of helping other. And I would love to help other people that are planning on getting to these exams. I cannot do anything for the residency program. However, at least this is something that they can do. I always say, well, you know what? Your exams are like buying a lottery ticket. If you don't buy a lottery ticket, you will never win. So,
exactly.
If you buy the lottery ticket, just pass the exams. And then the rest will come.
Right. So thank you so much for coming to the show, and I appreciate being educated myself. And to our viewers, thank you so much for watching, and we'll see you next time. Bye.
Bye.